as well. So I wanted to thank all of you for coming here to be on this webinar, as this, for some, and actually for a lot of us, this is a very difficult topic. So again, appreciate all of you being here. And I wanted to introduce our two fabulous presenters who are going to be able to share the information to help you through this process, because I mean, honestly, this is a fact of life. So it's good that we get involved with it, doing this prior to everything. So with that, I want to introduce, first of all, Laurie, and I'm Buelna, LCSWCG-C, and I'm sure she can explain when she comes on what the CG-C is a supervisory social worker who has worked at the VA Palo Alto healthcare system for 25 years. She is trained in geriatrics, medical and mental health social work, and provides clinical supervision to other social workers working toward their clinical licensure. She started as a social work intern at VA Hospice Community Living Center, VA Nursing Home, then worked in a variety of areas, including inpatient psychiatry, emergency room, inpatient medical surgery, Defender's Lodge, and Fisher House coordinator, inpatient spinal cord injury disorders rehabilitation center, outpatient SCID, supervisory for primary care, including Women's Health Center, home-based primary care, homeless hot-tail program, digital divide, advanced care planning group visit program. Whew, that's a lot. All right, but this is really cool because last year she was selected as a primary handler for Ralph, and I know he's there with her right now. And they are Ralph is a VA facility dog who provides canine therapy to veterans and staff at the VA clinics as part of the VA recreational therapy program, supporting wellness and whole health. So welcome, Laurie and Ralph. I did hear him in the background. So again, very cool job that you have to be Ralph's handler. All right. So in addition to Laurie, we also have Sylvia. She's an advanced care planning social worker who performs outreach to our most vulnerable rural populations while building a program and facilitating groups. She graduated from USC in 2017 and will be at the VA 2 years this September. She was recently working with the VA Caregiver Support Program while adding to her experience as a crisis clinician working with families and children, providing direct interventions in homes in the community. Sylvia also has experience working with other populations, facilitating specialized group treatment that help reduce recidivism. She's an Air Force veteran who supported the Air Force mortuary affairs operations during her time as a histology technician from 2000 to 2006. Let's all welcome Sylvia and Laurie, and it's all yours, ladies.
Thank you, Melissa.
Thank you.
Nice to be here. Thank you, everyone, for joining us. Okay, we're very excited to be here with you. You're on mute.
Hi, everybody.
Oh, hello, everybody. Welcome. Thank you for being here, and we appreciate, that you are here and that you are willing to listen to this conversation. Like Melissa said, it can be sensitive, and if you need, additional support, you can always let us know or email us. I will give you the point of contact if Melissa hasn't already, so that we can, provide further support if needed. And so we'll get started. We like to ask these questions that you see on the screen. Okay, so I'll read them, and then it's something for you to start thinking about, right? It's kind of helping you brainstorm, so to prepare you for this topic that we're about to educate you on or provide information on. The first question we like to ask everybody is, how knowledgeable are you about advanced care planning? And so the options are not at all, a little bit, moderately, quite a bit, or extremely. And number 2, I have thought about what I would want if I were hurt, injured, or sick and could not communicate. And that would be either yes or no. Number 3, I have thought about my treatment preferences if I could not communicate them during a mental health episode. A lot of veterans say no to this one, and that's perfectly normal. We're here to help you fill that in. And number 4, I have talked with someone I trust to make healthcare decisions for me. Number 5, I have named someone to make healthcare decisions for me. Number 6, I have discussed these topics with someone on my healthcare team, doctor, nurse, or social worker. And a lot of veterans normally don't know that they have a healthcare team. If you have a primary care doctor, then you have a team. And with that comes a social worker. So we'll give you more information about that towards the end. And then number 7, have you ever filled that in Advanced Directive? Yes or no? And so we'll go to the next slide, please. And then Laurie can touch a little bit on this one.
All right. So I just wanted to share that this is a program that's supported by our National Social Work program at the VA, and it's Diffusion of Excellence program, where we think of things like this in advance and try to encourage all of our veterans to think about what their goals are. To remind them that this is a gift, to think about this in advance, about what we truly value as human beings, whether it be spending time outside with the sun, with the natural elements of the world, of nature, spending time with family, being a part of something in our community that's really important to us. Whatever our role is in our family is also very important, or in our community, or among our friends and family. So really, it's all about what we value and what's important to us, and the time that we spend, how do we want to spend it? Quality versus quantity is sometimes what I hear from my veterans. They want to spend time doing things they enjoy and then not do things they don't enjoy. So it's all about our right to make that decision in advance. And it's really a gift to sit down with our family members or our relatives or our significant others and share what's important to us. So this is a group where we want to sort of bring out emotions and thoughts and the content of what our human experience is in this group, to, I guess, bring that forward, because that's what matters most, is who each of you are and what you bring, and what you bring in life experience and what's important in your life experience and how you desire to spend your time. Since we're all temporarily able and temporarily here, we're living mortal, and that's a fact of life. So we want to bring it out there and propose that we think it through in advance with support from one another. Thank you. I can talk about this. So all of our veterans that are connected with the VA, all people have the right to make healthcare decisions for themselves. They have the right to make an advanced directive or not. Some people don't, they choose not to. That's okay too. We have the opportunity to encourage our veterans to participate freely in our advanced care group visit program. It's not based on age. It's not based on health status. There's no sort of ulterior motive, where we're trying to get you to do or sign up for something that you aren't really interested in. So really, it's just a voluntary thing. We want to give information and share and help people share their perspectives. That's what's meaningful. Finding the meaning for them, respecting that in this group. And it's highly recommended to think these things through in advance, because what ends up happening is we learn that our family members, our relatives, whoever it is that's put in the position for making these decisions for us when we're in some sort of a pickle, they don't know sometimes what it would be. They may be conflicted as well. They may be stuck with their own psychological distress or emotions that they're flooded with because of what they're confronted with. Caught off guard, stunned, shocked. So really bringing someone in that you trust, bringing someone in that you can have them hear and be a witness to what's important. That's what we really value and encourage. So completing an advanced directive is optional, but the most important thing is to review what your desires are with the people who are going to be representing you in case of a crisis, because that will happen at some point. Something could happen. We never know, right? So thinking it through in advance is what we really value and appreciate and want to welcome you to do. Thank you. Next slide.
Okay, so with today's meeting, we're going to be reviewing what is an advanced directive. We're also going to be touching on just a few facts for organ and tissue donation. We're going to talk about some life-sustaining treatments and some questions that you can ask your doctor. And just briefly, I'm going to touch on what is a POLST, P-O-L-S-T. It's a physician's order for life-sustaining treatment. And a lot of veterans like to have this because it has a little more power than the advanced directive. It's something that you carry with you. It's big, bright yellow or pink. And people like to have it when they have a special health condition, or maybe they have a critical condition where it requires specific treatment. And this you can talk to your doctor more about if you have more questions. But I just want to let you know that this form exists, and it's called a POLST. Think about it as orders, the physician's orders. Okay, I like to say that because of the military, right? Orders. And then we're also going to talk about what is goals of cares. What are goals of care? I'm sorry. And that will be it for the screen. Thank you. And just like Laurie said, advanced care planning is about preparing your thoughts, right? It's about preparing your loved ones for either temporary or permanent situations, for accidents and what ifs. So we may, of course, not come up with all the what ifs, right? But we're here to help you brainstorm and prepare for the future for the what ifs. And I like to read this little quote here. It says, frustration caused by wishing things were different diverts energy from making things different. And next slide, please. And also, like what Laurie said earlier, this type of class will probably make you start thinking about life a little bit different. It'll make you start looking at your choices. It'll make you start wondering, well, what is it that I like? What do I enjoy? What are the basics that I really need in life in order for me to feel safe and comfortable? So it's going to be completely normal that you start questioning, things as you go through life from now on, to start kind of maybe enjoying it a lot more. And so advanced care planning can make you look at your life with more mindful eyes, right? It can probably make you start thinking, well, what relationships should I repair, or should I build new relationships? Or what kind of thoughts am I having? What kind of fears am I kind of, using to hold myself back from maybe talking or preparing the legal documents I need, right? Or maybe having a conversation with my family. So just a little heads up here, and that's good for this slide. Thank you. And I don't know if you were able to share this video. Are you able to play this video, Melissa? I don't know if you shared it with audio because we can't hear it. Maybe not.
There may be an illness.
Oh, there we go. We might want to rewind it again. Now I can hear it, but can we replay it?
I'll give you an example.
Thank you. Maybe putting your volume up just a little bit.
And I think what we've typically seen is that this conversation happens when folks tend to be older, or there may be an illness. And so I think in the minds of everyone, it's kind of something to happen when you're quote unquote old and sick. I'll give you an example. I just ran a table at an expo that we had recently. It's called the 50 Plus Expo. And I was just asking people as they pass, do you have an advanced directive? Have you had this important conversation? And one of the people said, I'm 87 and still ticking, so I don't need that. And it was just this idea of that's something I'll think about when I'm sick. And so really our campaign is all about trying to get anyone over the age of 18 in the county to talk about this so that it's not this kind of scary, death focused, if you bring it up, it means something's wrong with you conversation. It's just something that we all do, because as we all know, anything can happen to anyone at any time. Just because you are 18 doesn't mean you're invincible. So I think that's really important for us, is to take it out of that mindset of it's for death, it's for sickness, it's for older people, and make it more of a cultural norm.
I'll let you touch on that, Laurie.
Great. Yeah, I think it's a wonderful opportunity to sort of embark on this with you and sort of get the thoughts in your mind going, because it's about our goals, right? And about what we have left to do in our life and what's unfinished business. What do we want to do? What are our goals? And then really talking with our providers about that, sharing what's important. The next time we have an opportunity, sharing that with our doctor, whether it be a mental health provider. Some of us have experience recovering from a mental health issue or a medical issue, or we have relatives that have as well. And just taking that time aside and pointing things out to your provider so that they're really clear on what is important to you, you as a person, and the whole person, your mind, your spirit, and as I mentioned, you know, everything that you do and what's important to you, your function in life, your social role, your personal role, and what you spend your time doing, devoting your time to, making sure your providers know what's important to you too, I think is essential. So here I can talk a little bit about what an advanced directive is too. So it's basically a legal document. Many of you have probably heard of it. Sometimes people go ahead and get their living will done as part of their advanced directive, which that specifies your goals of care and what different scenarios you would pick as far as healthcare interventions, like a life-sustaining treatment such as an IV feeding, hydration, something like that. For example, a feeding tube, that kind of thing you've heard of. So an advanced directive is basically a legal form, and it's where you appoint a decision maker. Sometimes you can appoint the person effective immediately, right? Or sometimes you appoint a person so that in the future, if you're not able to speak for yourself, that person can speak for you according to what your living will sections. So they basically are appointed to uphold your preferences for you, not theirs for you, but yours for you. So finding that person is what sometimes we brainstorm with people about. It doesn't matter where they live. It doesn't matter, you know, the detail. They have to be mature enough, right, to be able to make a decision and represent you. So it shouldn't be a minor, but really, this is something that we would want to promote if you would be willing to complete an advanced directive. It is really helpful. Also, if you don't have someone to appoint, that's okay. You can just complete the living will section. And there's many different types of forms. There's a California advanced directive. There's a VA advanced directive. You can go to an attorney and do an advanced directive. So there's no right or wrong.
Uh-oh, we lost the PowerPoint for a minute.
It should be back.
It should, yes, I see it. So an advanced directive, right, like Laurie said, this is where you assign what we call a healthcare agent, but you can call it, you know, emergency contact, or just somebody to, you know, make decisions for you. And this becomes a legal document when you have two people witness it, signing. And these people cannot be anybody that you assign as a healthcare agent. It cannot be anybody that you assign in any kind of financial document like a living trust. It has to be somebody outside, like another maybe family member or neighbor, or maybe social worker, maybe a nurse. And So as soon as those two people sign it, it becomes a legal document. We encourage people to make multiple copies and give these to your assigned people. This is maybe a way to communicate like, hey, I assigned you as my healthcare agent. How do you feel about that? Let's talk about my treatment, right? It's about having the conversation. So this is one way of doing it. I'm going to give you more tips as we get through this PowerPoint. But definitely give one to your doctor, right? Give one to your families or maybe people that you trust that will be able to help you in an emergency, right? So what we're going to do, we're going to be going through what you can actually write in the living will section. A lot of veterans just kind of check the boxes, yes, no, or I want you to talk to my healthcare agent. And then what I was just going to say that we're more than just boxes. So I want to be able to emphasize on the detail about you, what makes you unique, because we want to help you connect with your identity. Next slide, please. Okay, so with this, a lot of veterans may not be ready to fill out the living will section because it takes a lot of detail. It takes time to fill out your advanced directive if you really wanted to fill it in, and it's something that you can always update. It's not written in stone. You can always go back and say, hey, no, I want to change it, or I need to change my healthcare agent because it's not working out, or whatever that case is. We recommend that you take a look at it at least once a year. And our health changes, our values sometimes change, our beliefs, right? So just check in on it. But if you don't feel like actually writing in the living will section and you just want to assign healthcare agents, you can do that too. So you can fill out the first 3 pages and make sure you get that notarized, witnessed, and then submit it. And then you can always, add to it or create a new one, right? To add more details in it. But I wanted to emphasize some boxes that a lot of people tend to skip on the advanced directive. There is an option where people choose to assign healthcare agents. So you initial, I do or I don't want to assign healthcare agents. Another box that a lot of people forget that is really important is whether you want this living will to be followed as a general guide, or do you want it to be followed strictly? Meaning, do you want us to talk to your healthcare agents, to your emergency contacts, or not? You want us to just do exactly as you say. So those, you pick the one that you designate for yourself. Next slide, please. I'll let Laurie do this one.
All right. So let's start the conversation. Could someone in the audience share a time when they had to make medical decisions for a loved one or a pet? How did that go? Anyone able to share? You might not be feeling comfortable in this setting. That I respect.
If anybody wants to respond, I believe you have to unmute yourself and then you can respond. That's probably what's going on.
Yeah, it's Nate. Hi, I'm Evelyn Pate. I didn't have to make these decisions, but I did have to help my mother with this format, with these forms. What is it that you prefer? If you get ill, if you're no longer are able to speak, what would you like me? What would you prefer? So I had to go through this and explain this, because a lot of people think that we all understand what is written, and sometimes we don't. So it was a little bit difficult, but it was necessary. And I am so glad that I went through that process, because my mom now, dementia has taken over, and she doesn't remember, but I do have all this paperwork already for her.
Oh, that's wonderful. What a gift that is, that she had you to help her with that, to
It was-
support her wishes.
It was very difficult, emotional when it is close to you, your parents or your family. It's not an easy task, but it's something that it is so valuable because now I know exactly what she wants. I don't have to think about, because most of the times when we make decisions like this is what we want, it's not what they want. So it's so important and it's so necessary. So just wanted
Wonderful. Thank you for sharing that, Evelyn. I appreciate it. All right. And what does advanced care planning mean to you? Those of you out there may have been through something like this. What does this mean to you? What's the meaning?
Hey, it's Kelly. Hi, how are you?
Hi, Kelly.
Hi.
Hey, the question was what does advanced health care planning mean to me? Is that correct?
Correct.
Okay, thank you. My husband and I have a his, mine, and our situation. And unfortunately, my father, the Vietnam veteran who was very ill, did die very suddenly. And it was really, I don't want to call it a train wreck, but I'm going to use that phrase for now. I mean, he had nothing picked out, nothing in place for my mother. It was really, really not a great experience. She didn't feel comfortable choosing things for him. I didn't. I really didn't know him very well. And it just wasn't good. So my husband and I got our home in trust. We got our advanced healthcare directive squared away. We both already got a pre-needs, with the mortuary prepaid because, of course, we get a lot of great things as being veterans, but we don't get everything. You still have to hire an undertaker. We picked out how we wanted to be, buried or cremated. We filled out the form for the veterans cemetery near us, and we did everything. So everything is in one book. So our children have a copy of all that, and all they have to do is call two people, the lawyer, which would be the property part, and the will part, and the mortuary, and that's it. And then it doesn't matter if they don't like what we've done. It won't matter. We've already done it. It's what we've decided, and we feel that. And it wasn't cheap, I will say that, but we do feel that our children, especially because we have a his, mine, and our thing situation, which adds up to a lot of kids, that we made the right decision. And me personally, I had something silly on mine. I want to be hydrated, but I don't want to be resuscitated. So if I'm dying, I want to make sure that my wrinkles aren't showing really bad. And everybody got a good laugh about that. But what's cool about that is that's my decision and that's what I want. So, and they can have a laugh about it, while I'm passing away. But I don't want our children to go through all that. So it means, I don't know. I kind of look at things like this as freedom and a positive experience. Thank you.
Excellent. Thank you so much for sharing. That is exactly right. Everything that you just shared, it's freedom. And it's sort of your right to choose and your right to speak up and share with your family in advance about what you do and don't want, what you do and don't like, and what matters most to you. And that is an assurance to put that into place in advance. And also, it's a gift to your family, because what happens is it can cause so much stress, right? It can be a crisis for your family when they're trying to guess and put it together. And as you mentioned, a train wreck. It can feel like a train wreck for a family. So as a leader of your family, as the matriarch and the patriarch, you have taken the lead. Very respectful of you to do that, and respectful of yourself and
Great.
your family too. So thank you.
Thank you.
How did it feel to have that responsibility to make decisions for someone. Can anyone share what that felt like?
I don't want to be that guy, but since nobody said anything, I'll say
Go ahead.
selecting things for my father made me feel very uncomfortable. I didn't really know him very well. And my mother was such a wreck. It was, it was just really unexpected. She was such a wreck. It was just difficult to even pick out. We didn't think he wanted to be buried, but we didn't know if he didn't want to be buried. He was raised Catholic, but I don't think he was a practicing Catholic, but my mother was or is. And but the cheapest way to go was to cremate him. So what a weird burden for my mom to think, oh my God, it's going to cost me $40,000 to bury the guy, just making that number up, but it's only going to cost me $1,700 to cremate him and pick out an urn. Do you know what I mean? I mean, it was really a big pressure.
Yeah.
And I think even to this day, especially because of her generation, so I'm in my 60s, my mom's in her 80s, I still think she kind of wonders, if, gosh, did I make the right decision? What's he going to say to me when I see him again? And I feel really bad for her because there's nothing I can say. I've already said it all. Hey, it's done. I don't think he really cares. I think he's okay with it. It's just kind of how we believe, she believes, after you cross over, but she still isn't comfortable with it. I think it's a big pressure. And honestly, I'll just tell you my little secret. I was almost mad at him for not taking care of my mother because I know he loved her. They were together for 60 years. And probably because I didn't have a relationship with him, in a way, I thought, God, how dare you not take care of your wife when, especially in their day and age, that was something that was talked about a lot, important. And it almost made me angry at him for doing that. Of course, I'm not angry at him anymore, but it wasn't pleasant. I'll say that. Thank you.
Yeah, it's an extreme burden to try to be put in that position where you're guessing and then discovering the cost of things, of all things related to these decisions. A big piece of it because it is part of the decision. And also we don't want to do harm to our loved one and we don't want to make a mistake. So it can be a very difficult responsibility. And it's so sensitive, as you can see. It involves your spirituality, your religious views, your personal views, and out of respect for human life and the spirit and beyond, it involves all of those things. So it's a very difficult, thank you for sharing. It's a very difficult thing to share, and I appreciate that you did.
Hi, I have something to say on that matter too. It's also, you have to take into consideration cultural things too, because we are from my mom is from a very different culture. And so you have to be also mindful of what they want. Like my mom is in her 80s also. And I already know she wants music. She wants music, a particular music. She wants so many particular things that mean something to her. She wants jewelry. Well, okay. So, so there are so many things that maybe we do not consider them important, but they do. And yes, and I believe there'd be a lot of pain and grief and everything, but let's take into consideration those things too, because they are important to them.
Exactly. Culture is so important. And I'm so glad you raised that today. And you could illustrate for us perfect examples of how it's different for each person. Everyone's culture is different, and we just can't guess by looking at a person.
No.
We have to talk with them and give time and space to listen and have them think about it too. It might not be on the spot where you say, okay, mom, tell me everything. She might not think of it all in one sitting. It might take a few days or a couple of weeks for her to really think about it, maybe read some things on it, and then get back to you. And
But
that's okay.
yeah, but another thing is, don't make those decisions because you think it's weird, or because those are your beliefs, not
Yeah.
theirs. Because a lot of people say, "Oh my gosh, I wouldn't do that because it's so weird and it looks bad," or whatever. It's not about you. It's about this person. Like I said, she wanted music. I'm going like, really? Yeah. And I want this specific songs, by the way. Okay.
Wonderful.
So, it might sound weird to you, but let's honor them, and something as small as this. So that's all. Thank you.
Yes, I appreciate that so much. Thank you for sharing that.
And that is
Good.
the beauty about being human. Just wanted to add that.
It is. Yes. Out of dignity and respect, care and concern, and devotion as a loved one, it's an opportunity to bring out all of the things that are valuable to a person. The next question is, would knowing what they would have wanted ease some of that responsibility to make decisions?
Yeah. Yes.
I heard yes. Yes. I see yes on the
Yes.
text too. Yeah.
All right. All right, we can move to the next one. Do you know who would make medical decisions for you if you were incapacitated?
And this can be a rhetorical, just something for you to think about. Do you, know who can speak for you?
Right.
And if
And
not,
also sometimes like Sylvia said, it changes. So, people learn more about individuals and what they're capable of. They meet new people, they build new relationships, and they have a better understanding of the person that they once appointed. So you could always change that person too. It's not stuck in stone, carved in stone.
Mm-hmm.
thank you everybody for responding. I see the chats.
Yes, I
That's-
see. Great
that's
job.
good. Yeah. Okay, we'll go to the next slide, please. And thank you, everybody. This is amazing. I love that we're all participating. And this is a copy of the Veterans Advanced Directive. So the left side shows the boxes, right, where you click or you initial yes, I'm not sure, talk to my healthcare agent, or no. And then we're going to be focusing on the mental health preferences next. And after that, we're going to touch on the additional preferences. And this is where we're going to touch on a lot of the cultural beliefs, right? A lot of other things that you would like. And so just to read that, it says, it's not just about filling in the boxes. We would like to know details about what matters to you, because you matter. Okay, think about what you need that helps you feel safe and comfortable. Let us know so that we can provide that as much as possible. Next slide, please. I want to ask a question though, or before I do, I want to say this. We're all human beings, right? We have great days, good days, awful days, crappy moments. What is it about you, right, that you make yourself feel better? What do you do to kind of try to turn that around? You don't have to answer that if you don't want to, but I can share some examples of what other people have said. They've said, well, maybe taking a shower, maybe taking a nice walk, feeling the sunshine, maybe feeling the rain, right? A lot of sensorial things that kind of just connect you to the basics of nature, to make you feel alive, to connect to your soul. Maybe the music part, you can play a song, maybe you can dance, maybe you can call your friend and, tell a joke. But what is it about you that you know works for you, right? For people that are married, or maybe they are with a significant other, I like to ask this question. I say, ask your significant other how they know when you're having a bad day. What does that look like from an outside perspective looking in? These are the details that matter in this section about your mental health, right? Like, give us a little bit of preview. Well, when you see that I'm a little bit uptight, or I'm cutting people off, or maybe I'm getting a little grouchy, or maybe I'm sweating, maybe my blood sugar is down because I forgot to eat and I'm just, doing this and that. Please help me by feeding me, maybe, right? Or giving me some space and giving me some music, or, what is it that you feel like you can provide to us to better help you, right? To become maybe less agitated, just to be more comfortable so that we can better treat you. Some other things that people write in this section is medication. Maybe you take medications at certain times. Maybe you have high anxiety. When accidents happen, I know my emotions go, skyrocket, and I want to calm down. So what do you do in those moments? Or what can we do in scary situations to help you feel more comfortable, right? What medications have you taken that worked? What medications have you taken that haven't worked and maybe have caused some major side effects that you never, ever want to experience in your life again? Write it down here and say, okay, I've taken this medication. It's caused this side effect. I've felt nauseous, tired. Stay away from these side effects. So write it down. Let us know what you don't want to experience again, so that the doctors can do their best to find something else, right, that works for you. So write a list. This is very important. Or if you've ever been to any kind of, mental health facility and you really enjoyed a program, let us know what facility. Let us know where you want to go. This is important because it's details about you. And like I said, if you don't know the answer to this, a lot of people say, well, I don't have any kind of mental health diagnosis. You don't have to. It's just a human thing. Like, ask your friends, your closest friends, your family. Okay, what does it look like when you're about to blow up or when you're triggered? We don't know. And so we just see another human being, right? But if you give us a list of what to look for and what to do to comfort you, that would help you overall. So Laurie, would you like to add anything on this part?
Yeah, I was just thinking, I'm thinking of a particular veteran that I served one time, and she let me know that there were particular things not to do. And that was really effective. So she wrote out, who not to involve, specific people in her life that might show up to the party, as we call it, out of the woodwork, as we call it. Please do not share information with this person. Please do not include this person, or please do not do A, B, and C. So I just wanted to put that out there too. Oh, you're on mute.
I said that is important. So tell us what not to say or what not to do, because I know a lot of people are particular about certain words, right? Especially in, sensitive times. Let us know how we can better help you. We want to serve you, do the best that we can to feel, to make you feel less agitated, less afraid. Next slide, please. Okay, and this is where we talk about all of the other additional preferences, right? On that next box that we saw two big boxes that people normally leave blank because it takes some of this, like education. A lot of people are like, oh, well, I never knew that I could write that in there. But now I know, and thank you. And so, you are important. Your culture is important. Your identity is important. Your experiences are important. What makes you feel safer in situations? What can you tell your family members that they can do in this, period, temporary or permanent, right? To provide you more comfort, more care, more love. A lot of families are kind of left thinking, well, I don't know what to do. The doctors and nurses are doing everything. Do I just sit here? But, this is where you have the conversation about, what you like, your values, your life, what's important to you with the people that you love. So that way they know, well, I know that they like this music. So if you tell them, play it while, I don't know, in critical condition. And when you visit me, or if I'm in a coma, or if I'm not able to walk, can you ask to see if you can take me to the window or to the garden so that I can get a breath of fresh air? You can talk to your family and ask them, how would you feel if I asked you to push me around in the wheelchair for a little bit? Or, if you do this for me, play the guitar, because, I love the guitar when you play it. Things that are very specific to you, right? Our religious beliefs, it's really important to let us know. If you don't believe in blood transfusion, this is where you want to let us know, like, no, I don't believe in blood transfusion. Please don't do this. It's against my religion. Or if you're talking to a religious leader or you're very spiritual, let us know who to contact. Or if you want us to contact the chaplain, right, at the hospital, let us know so that they can provide the services that you need. A lot of people like blessings before major surgeries, or maybe in accidents, they liked, certain treatment. Or maybe if they pass, they want other treatments as well. Please do let us know what your beliefs are so that we can, do the best to help you. And of course, your family members, your loved ones, those that are left behind. And other things that people like to write on here is, where, what you would like. Would you like to be cremated? Would you like to donate your body? Where would you like to be buried? Things like that. Laurie, do you want to add anything to this part?
I wanted to mention a little something that's come up in another group, another presentation. So just to share with you, medical providers, doctors, nurses, they want to do no harm. Okay. And so keeping that in mind, they didn't go to school to provide counseling support. They went to school, they went to medical school or nursing school to save lives and to offer, everything they could do aggressively to rescue and save you. Not so much about what's going to be most comfortable. Not so much about after this intervention or treatment, you're going to feel A, B, and C. It might make you weaker, not stronger. It might make you less able to perform those things that are so important to you. Those functions might be lost. They don't so much cover that as much. The risks and the consequences of things that we pick are not something that they really want to go for and talk about, because they, again, want to rescue you. They want to revive you. They want to do whatever they can, give you any medication, any surgical intervention, and provide you with everything that they can. But we don't want to do harm either. So where's the balance here? So I wanted to just put out there that it's really important to really understand and ask your doctors, ask your nurses, ask the people that are medically trained, what's in it for me to do this? What are the pros? What are the cons? What are the consequences? Given my health status, my age, my chronic conditions, my abilities now, is going for this going to be something that's going to promote me getting back to where I was before? Is it going to restore me back to my prior level? Because that's what I really want. And sometimes we're unable to guess. We're unable to prognosticate. We're unable, because we don't have crystal balls. The doctors and the nurses do their best to make that education clear with you so that you can make the best decision for yourself. But just be sure to really poke at that and ask those questions to advocate for yourself, because it could be in your best interest to really understand the impact of things that you pick, because they don't always come out with it. They'll just offer you this thing that you think, okay, is that a good idea? Well, we don't know. We didn't go to medical school. We have never gone through this before. So what are the implications? What are the goals of this? The goal is this to promote me back, or is the goal of this to keep me comfortable? What is the goal? So being clear on that.
Okay, next slide, please. So next, we're going to talk about goals of care. So what are goals of care? It's about easing symptoms to make you feel more comfortable, staying or becoming independent, curing an illness, or improving your quality of life when cure, is not possible. Prolonging your life, supporting loved ones through caregivers, helping you meet a specific goal, like maybe a wedding, graduation, family reunion, right? Your yearly family trip or your own vacation on your own. It's important to talk to your healthcare team about what it is that you still want to achieve, right? Especially when you have an illness or something happens, right, within your health. To get as specific as possible, right? Asking your doctor, well, what is this? How is it going to evolve? How is it going to change as I go through life, right? And then asking them, how can you help me still achieve the things that I want to achieve, right? Still keep my quality of life. Is this possible? Or is this treatment going to be too aggressive? It's just going to have me kind of lay down and be in bed all day. So this is where you start to kind of think about questions. Well, what can I ask my doctor, right? Or what should I ask my doctor? Things that are related to my goals so that I can make an informed decision on whether I want the treatment or not. So that's why it's important, right? To get all the education possible, ask all the questions that you need so that you can decide, well, this treatment is for me, or no, that's not the treatment for me. What are the other possible, treatments? Next slide, please. And I'll let Laurie, I'll let Laurie talk about this one.
All right, thank you. So what are life-sustaining treatments? LST. LST are things that help you maybe with your comfort, your level of severity of symptoms. It may prolong your life. It might be a temporary thing, or it might be a long-term thing. It really kind of depends. So in an emergency, it might be cardiopulmonary resuscitation, or you've seen on TV or heard about CPR. It might be mechanical ventilation. We've learned so much about that in the past over a year now with the pandemic. Feeding tubes can be temporary or permanent. There's different types of feeding tubes. So kind of understanding what they truly are. We have handouts that we can give people to kind of read through, and it's a definition of what these things are, and understanding what's going to work and what's not going to work. What's another option would be dialysis. Sometimes people have a chronic condition like diabetes, and it ends up affecting, in the long run, it might affect their kidneys and their kidney function, which then affects your overall organ health. To clear the toxins in our system, we might sign up for dialysis. Well, what is dialysis? What does it involve? So really understanding, how might I feel during dialysis? How much time does it take during the week? What is it like? So really understanding, is that for me? Or is it something I would choose not to do? Is it going to put me in a position where the condition will be erased, and kind of like a surgery where you remove a tumor or something, and then now the tumor is gone? Dialysis is something different than that. What it does is it actually takes over for your kidneys, and it functions for your kidney like a kidney. And then the machine removes the toxins from your system. So it takes many, many hours, and it can be very tiring. Some people think, yes, I want to do that because I want to prolong my life. There's things I want to do. I'm going to do that. Others say, no, I don't. It would be very uncomfortable for me. It's not for me. So just a little bit about that. It's sometimes hard to know what you would want to do in the face of making a decision, and that's okay. Again, we are human, and we change our mind too. So I've had many veterans that I serve change their mind from one day to the next. They try something out because they discover they want to do it. And then a day or two later, they say, nope, I want off the train. This isn't going to work. I'm done. And so that's okay. We can change our minds. We just have to tell the team. We have to tell the doctor and the nurse, this isn't comfortable for me. I've decided against it. I gave it a shot. I don't want to do it anymore. Okay. So, because things can change for us, and each person is unique, right? You know, you've heard some medications work for some people, sometimes they don't, right? So it's the same idea. Each of us are unique individuals, our bodies are unique, and you know, based on human heredity or ethnicity or our lifestyle choices or whatnot, it's all very complicated. Our health is something that is different for everyone. And the way that these life-sustaining treatments work for us might not work for another person, vice versa. So it might be worth a try, but just knowing that you can change your mind.
I see you. You're a good girl.
Next slide, please. So these are the other life-sustaining treatments, right? Like the feeding tubes, asking about what type of feeding tubes there are, which type would work best for you and your condition, right? We're not doctors, so we ask you to have this conversation with your doctor according to your own health, right? Like, is this something that I should consider? Which one should I avoid? What's the risk of infection? What would happen if I do need feeding tubes for months at a time? What would that do to the rest of my body? And what does that mean? Will I ever recover? Or will I have to live with certain conditions for the rest of my life? Asking those type of questions, like how will it affect me later if I decide to do this? And then, of course, if you're ever in a situation where you are hospitalized and you just can't stand the hospital, you can ask to go to comfort care, hospice, palliative. This is temporary or, you know, a permanent thing, but just communicate, right? Or if you want to go home, just say, you know what, I want to live the last few days at home surrounded by my family. What can you do to support me to do that? I don't want to be in the hospital. And we did touch on, you know, some mental health treatment options, right? And what you can write in your plan. And of course, other special treatment and procedures. You can always ask if there's something that we haven't mentioned. Please feel free to ask your doctor and see what they say to give you more of a bigger picture.
Yeah, that's the wonderful thing is they're always making advancement in the medical field, right? They're coming up with new trials for therapy. So it keeps hope alive. And so I think just being open to discovering what the opportunities are, I think is really great too.
Definitely. Next slide, please. So this is what is going to help you decide who can be your best healthcare agent, right? Your emergency contact or just individual to help you during those situations. You should be able to have a conversation about your own values. You should be able to talk about your spiritual beliefs, especially treatments, right? That may or may not be right for you. Have a conversation with them. And this doesn't have to be all done in one time, right? It's, you know, maybe you can start small and then work your way up and then talk about other things. And of course, let them know, like, I plan to make you, or you are going to be making decisions for me, whatever that is, right? Let them know so that way they're able to speak as if you were there. And of course, the advanced directive is only used when you are unable to make decisions for yourself. If you're awake and you're able to communicate and make decisions, then we're going to ask you directly, what would you like us to do? So just so you know that this is only used in that time when you're unable to make decisions or you're unable to communicate. Next slide, please. So these are some tips to help you with the conversation, right? If you haven't had a conversation with your family, or maybe your family is not used to talking about this kind of stuff, maybe you can start thinking or just sharing some of these things. Like, what does a good day look like for you? Who or what supports you during difficult times? What matters most to you as you go through life? Is it the ability to recognize your family, your children? Is it being independent? Is it both? Right? Is it just being able to be around your family regardless of your physical condition, right? Accidents are part of life, and maybe something may happen that, you know, limits your movement. Will that still be okay for you as long as you're around your family? What is important to you? Sharing it with people that you trust can help. definitely in a situation, right, where they need to communicate with the healthcare team and let them know, hey, this, my aunt or my mom or my cousin really enjoyed doing this and that. And she would like to be by the window looking at the sunshine every morning or feeling the sun. What makes you feel safe? Definitely sharing that. Like, what is it that makes you feel safe that you can connect with? What can your loved one do for you to make you more comfortable? Anything else that you want to add here, Laurie?
I don't think so. I just think, that our ideas change over time. So I think it's always good, to know that and to evolve and be open to that.
Definitely. Okay, next slide, please. And just to review, right? Asking your doctor specific questions. Like, don't be afraid to ask about percentages. Like, what percentages is this treatment going to help me? Is it 80%? Is it 20%? Do you think it might not even help me at all? It's just something we're trying. Will this cure my illness? What type of quality of life will I have while receiving this treatment? And just a review that doctors did take a vow to do no harm. And it's not that they're giving up. It's just that they can't, do anything anymore because that will just cause more pain and suffering. And they took a vow to not do that. So just a reminder, it's not that they're giving up. It's not that they don't want to. It's just that they can't, and that will cause more pain and suffering. So it's against their beliefs. And then you have the right to refuse any treatment. You can say, you know what, that treatment's not right for me. I don't want chemotherapy. No, thank you. I just want to live my life and continue working. And can you just get me comfortable? Or what can you do to support me while I'm living the last few months or years, right? Asking these questions and saying, no, it's okay too. This is your life. Laurie, anything for this one?
Oh yeah, just a little bit more about doctors. Some doctors are really, really good at surgical procedures, or they're really good in treating people with serious medical conditions or chronic conditions. And maybe their bedside manner isn't the best. Maybe the way they come across isn't as careful or considerate in the words that they choose or the way they approach people. And that doesn't mean they're not excellent doctors or excellent people or excellent humans. So I just wanted to just promote that, that's where you would want to speak with a social worker or a psychologist or one of your nurses, perhaps, or a chaplain or someone from the community who could be that comfort for you. Sometimes doctors in their meaningful discussion that they're having, they get very technical. And it can be a huge turnoff. It doesn't feel warm. It doesn't feel sensitive. It's very technical. And it can be really shocking. So I just wanted to put that out there. I've worked with many physicians, surgeons, and really you do want the best doctor. You do want the best surgeon. So when you can trust and all of that, and maybe the rapport side isn't so good, but they're really good at surgery. So I just wanted to put that out there because I've had some physicians create a lot of social work for me. And so then I go in and work with the veteran to pick up the pieces left behind. And so anyway, that can be a factor. So I just wanted to share that with you from my experience. It's not that good people.
That is very important. And we want the best doctors. We want them to do their job. That's just part of their job. That's the way that we want that. So ask for a social worker or chaplain, definitely, to help you during those sensitive times. Next slide. Okay, so other things to think about right now that you're currently able, right? You're able to think, you're able to plan. You have, we think we have time because nobody's guaranteed any time. Young, all ages, right? Anything can happen. So it's a good time to start talking about long-term, right? What kind of long-term plan do I have? Do I know what I qualify for as far as benefits? Do I have Medi-Cal? what does a VA cover? What doesn't it cover, right? A lot of times people think, well, I'm going to live until I'm 100. I'm going to be able to tell you exactly what I want, and then I'm going to die. And that's not always true, right? Sometimes there's complications, or we live longer and we need more care. And, where will you go? Who will help you take care of you? Do you know how much it costs to live in a long-term care facility? So doing some research now and just planning, right, more, and talking to your family, definitely involving them, and just making a plan, and maybe calling your social worker, scheduling an appointment with your social worker and asking them, well, I'm 100% disabled, or maybe you're not service connected. What can you support me with so that I can plan properly? What should I be looking at? How much money should I be saving? It's just part of life, right? And you can the appointment line and schedule with your social worker. I will be providing it in the next slide. Next, please. So this is the one for Palo Alto, right? I know that some phone numbers, if you're not in the area, change. So just call your appointment line and ask, to make an appointment with your social worker if you have questions about your benefits or about any kind of support that you need, right? You do have a team, so why not ask so that you can better plan, right? Get some more information. Next screen, please. And some other things to help you, right, with yourself, with your own thoughts, if you're not ready to even have a conversation. Maybe you can write a letter to yourself or to your family members. You can write a to-do list. You can start writing your bucket list, right? What is it that I still want to do? What did I already do? What can I manage with? What makes you feel alive? What songs do you enjoy? What movies? Do you like plants? What foods do you like? You like sunshine, rain, or rainbows, right? So starting small, sharing these happy things with your family, right? And then kind of working your way into having a deeper conversation, right? Transitioning to more serious conversations. So starting small, sharing everything that you want to share, and asking them, of course, too, like, what do you enjoy about life? What makes you feel nice and safe and warm and fuzzy? Just, keeping it happy for, of course, always reminding them, what makes you feel happy. Do you want to add anything here, Laurie?
No, I think you're doing great.
Thank you. And next slide. And this is the VA next of kin policy that we follow. If you don't have an advanced directive, this is the list that we follow. A lot of people realize that, we can't just call people in an emergency. This is what we have to follow. So if you're married and maybe you're not in contact with your spouse anymore, I'm sorry to tell you, but we have to contact them according to the law, right? Spouse, adult children, oldest first, parent, siblings, grandparents, grandchildren, and close family and friends. So if you don't like this list, let us know by filling out your advance directive and letting us know the order that you want us to contact. Because if not, this is what we have to follow on. And just a reminder, if you do travel outside of the VA, every state is different. So I would definitely do your research, right? If you're planning on traveling and not close to a VA, just do your research and find out what their policy is, advanced directives, and maybe next of kin. Next slide, please. And these are just some facts, right? Organ and eye tissue donation. I'm not going to read all of them, but people of all ages and medical history should consider themselves potential donors. Your medical condition at the time of death will determine what organs and tissue can be donated, right? Tissue is needed to replace bone, tendons, ligaments, lost to trauma, cancer, and other diseases in order to improve strength, mobility, and independence, right? Corneas are needed to restore sight. Skin grafts help burn patients heal and often mean the difference between life and death. Heart valves repair cardiac defects and damage. If you do want to become an organ donor, you can always check on the, on your DMV application, or, you can go to donatelife.net, or I can provide you more information if you contact me. Next slide, please. And these are, just more facts about organ donation, right? In California, 20,000 people need organ transplants, and another website that can provide you more information. And this is the wrap up. Do you feel like this has helped? Has this been helpful? And feel free to, unmute yourself and comment on this. And if you don't mind emailing me your responses, whenever you have time, I would appreciate that. You can reach out to Melissa, provide my contact information. And, just be honest. If you have any feedback, positive, negative, please let us know. This is a growing area. This started off in the Midwest, and it's just gone to California in the last couple of years. And we're still trying to reach out to veterans, especially veterans, right? It's harder to get care out there. So if you know anybody that needs this information, please, I'll give them my information, have them contact me, and I will provide this. If you want me to present at any other place, please do, contact me too. I'm definitely willing to meet up and, provide information. Other rural areas. But any comments? Laurie, do you want to say anything before we open up for questions?
No, I really appreciate everyone's attention and focus and participation on this. I know it's not easy or simple, and it does bring up a lot of emotions. Uncertainty for sure, sort of that existential anxiety. So definitely, please, after this session, I welcome you to take care of yourselves. Stretch, walk around, get some fresh glass of cold water, whatever it is, some sunshine on your face, do something good for you, listen to some music, whatever it is that would be satisfying. And yeah, we'll definitely make sure you get a copy of the form that we're speaking to there, because we do want to get your input and hear back from you, specifically your experience of this. And we want to make changes to make it, and adapt to our audience and adapt to those that we care for here at the VA. And so appreciate your partnership in that too.
And I think there's more numbers on the next slide, Melissa. Oh, that's my contact information. And then the next slide has some other common phone numbers as well, like the Veterans Crisis Line, if you need that, or if you need any other kind of resource, here is some information for that.
Sylvia, I was wondering, would it be possible to drop the link to the form or the form into the chat is what we're having asked of us.
I'll try. Yeah, let me do that.
Okay.
While you ask questions, I'll figure that out, or while you answer questions.
Yeah, any questions people have?
Hi. You had a rough morning? Yes. Yeah.
Any questions or feedback or anything we can do to assist?
Hi, it's me again. I just would like to have a little bit more of your information because I belong to a vet group. This is a support group. And we talk a lot about very good subjects of what can the VA do for us. I just brought into the group about the cemetery, what can the VA do for us and spouses, and it's so interesting because I felt that everybody knew about this and not that many people know, and what are the steps to take before we die. So I would like to know your information, so maybe you can speak to our group.
We'd love to do that. Thank you, Evelyn. We'll share it.
Okay, thank you.
Thank you. Anyone else have anything to ask or share? Comments?
No, this was great information. Thank you so much for this. And I'm sure you'll be getting a lot of other inquiries, and I appreciate everybody else who also shared during this fantastic presentation, again, that everybody should be part of.
Thank you, Melissa. Thank you, everybody. We really appreciate the opportunity. Thank you that you've given us. Thank you.
Absolutely. Thank you.
Melissa, just really quick, will you be able to provide the form? It doesn't look like I can do it from here. The form that I emailed you for everybody with my information.
Yep, I could do that.
Okay, thank you so much. Appreciate that.
I'll send it in the follow-up email.
Okay, thank you.
Great.
Thank you for having us.
No, thank you. Appreciate it. Take care, everyone.